The lives of patients, researchers, and philanthropists are inexorably tied together, and this connection keeps propelling Macular towards bold scientific discoveries and life-changing cures. It starts with patients like Ines Yeatts, concerned about suffering vision loss from wet macular degeneration, the advanced version of the dry form. The desperate need for an answer spurred Dr. Joan Miller and colleagues to develop an innovative therapy, a breakthrough that has saved the sight of millions.
A group of us here and across the Harvard Department of Ophthalmology really were the ones that determined that this one growth factor, VEGF or VEGF, was the driver for the abnormal blood vessels and wet macular degeneration. And this led to the treatments which we now use.
Before, there was nothing that could be done for macular degeneration. And she developed this medicine, and I am so lucky to be here and to be able to go to Mass there.
Ines receives her injections from Dr. Demetrios Vavvas.
Before these therapies were available, pretty much all patients will lose sight within 2 years and become legally blind.
At the same time, Dr. Vavvas is studying what could be a game changer in the treatment and cure of dry macular degeneration, which could prevent patients from ever reaching the more dangerous wet form.
These lipid deposits in their heart can be helped when they're given high-dose statins like Lipitor. At the same time, we knew that there is a lot of lipid accumulation in macular degeneration.
Dr. Demetrios Vavvas, who is one of our most creative thinkers, said, well, that's sort of like outer retina. Why don't we try the high-dose statins for macular degeneration? We started a small trial, and in that study we showed out of about 23 patients that more than half of them really showed dramatic improvement in the deposits or drusen.
Up to now, indeed, there has been no cure for dry macular degeneration. This is an approved drug that millions of patients have taken with a very good safety record.
Patients like Ed Brown know firsthand what this discovery means to them.
When I came to Macular, I was really afraid that I would lose my eyesight. And after several months of taking Lipitor under Dr. Vavvas' care, I felt like there was a miracle because my vision actually improved.
Now, Dr. Vavvas needs to conduct a larger trial to confirm the results of the first.
About 150 million people in the world are affected by macular degeneration. So with this therapy, even if we can help only, let's say, 15% of the patients, that amounts to tens of millions of patients that could be helped.
These trials are expensive, and philanthropy is vital. Ines and her husband Fred Yeatts have been very generous supporters of AMD research and supported the first trial.
We realize it takes a long, long time to have any output or have any discernible value for individuals, but we know that they're going to get there.
They are the engine behind what we're doing, and that without them, pretty much nothing of importance would have happened.
Ines and Fred Yeatts have been tremendous supporters of the institution, both on the eye side and the hearing side. And they really make it possible for us to do the transformational research that we think is so important.
She's a hero to me. She's wonderful.
As time goes by, each of these people will continue to play their role, helping to transform possibility into reality.